Hello, my name is Isla Castano and I will be presenting on candidiasis. The following, and this is the disease of the day, and it's going to be scenario number 19. It's a pregnant woman who comes to the clinic with genital itching and a white semi-solid vaginal discharge, but with no unusual smell. She's also experiencing pain during intercourse, and treatment with antibiotics is not improving her symptoms. So the patient's symptoms include genital itching, white semi-solid vaginal discharge. She's experiencing pain during intercourse, and unfortunately, her antibiotic treatment is not improving her symptoms. So possible diagnoses include trichomoniasis, herpes, genital warts, gonorrhea, chlamydia, or a urinary tract infection. So testing would include a pelvic exam by a doctor, nurse practitioner, or physician's assistant. It would be a culture, and it's by taking a swab of her vaginal discharge. So this is sent to the lab and to be looked under with a microscope. The diagnosis is vaginal candidiasis or vaginal yeast infection. Other names are vulvovaginal candidiasis and candidal vaginitis. So, typically for a pregnant woman, over-the-counter treatment would include clotrimazole, which is the generic name for Miscelix, or Lotrimin antifungal. Another one is miconazole, which is Monistat 3, Turcanazole, which is Terazol 7. So just note that in women who are not pregnant, treatment would be prescribed as an oral antifungal, like fluconazole, which is also known as diflucan. So risk factors and prevention. The risk factors would be antibiotic use, increased estrogen levels, as in pregnant women, uncontrolled diabetes mellitus, an immune system disorder such as HIV infection. So prevention would be unnecessary use of antibiotics, douching as it removes some of the natural vaginal bacteria, staying in wet or damp clothes like bathing suits or workout clothes, trying to wear cotton underwear and avoid tight-fitting pants like jeans or workout pants. So, candidiasis comes from the species Candida albicans. It's an opportunistic pathogen. It's dimorphic, which is a single-celled yeast. It's gram-positive, and it's a structural morphogenesis, which means it goes between being filamentous and to hyphae. It secretes protease, and it also recruits neutrophils, which is a characteristic of inflammation. So I have here this picture is of a gram-positive staining of Candida albicans, and this is what a wet mount would look like under a microscope. The pseudohyphae of Candida albicans. So, and this is just a comparison of what asymptomatic colonization is versus symptomatic infection, and this is what a normal vaginal bacteria should look like as opposed to what has developed into a yeast infection and what forms the filamentous hyphal form. And so my final points would be that 3 out of 4 women experience a yeast infection in their lifetime. Unfortunately, if you're experiencing 4 or more yeast infections in a year, this could mean a disruption in your immune system. Something like, again, diabetes mellitus, or an infection such as HIV. So, in a sense, taking a daily probiotic can help prevent reoccurring yeast infections, and it also would help you if you are currently experiencing a yeast infection. You can take a probiotic along with the antifungal medication that you're prescribed. But as in the scenario with our female patient, the reason why her antibiotics didn't work was that this is not a bacterial infection, but it is a fungal infection. And this is candidiasis. Thank you.